Well, welcome everyone. What a great day for us to be here. My name is Kevin Smith. I'm the President and CEO at University Health Network, and it's a real pleasure to welcome back our Premier, our Deputy Premier, and our Deputy Minister. A great pleasure. I want to bring you greetings from our boards here, Dean Connor, who unfortunately, because his son decided to get married on him in the next few days, isn't with us, but I thought that was a pretty good excuse. Premier Ford, Deputy Premier and Minister of Health Sylvia Jones, Deputy Minister Dr. Catherine Zahn. I almost made you Deputy Premier briefly. Also want to welcome, of course, all of Team UHN who's here and some special colleagues. Our University Health Network Foundation Board of Directors, Raj Katari, Don Johnson, Barbara Muir. Have I forgotten anybody that's with us from our board? Forgive me. And of course, our new CEO, Julie Quenneville. So welcome one and all. I am not the voice you're particularly interested in hearing today, so I will step aside and call on our Premier, Premier Doug Ford, to speak to you about a very transformative happening here at University Health Network. Following Premier Ford, he will introduce Deputy Premier and Minister of Health Jones. Premier.
Boy, what a real honor to be here, and good afternoon, everyone. And thank you, Kevin. Only if people could see behind the scenes how hard Kevin works to make this happen, you know, and I appreciate all the work. And Dr. Zahn, thank you for being a true leader at the ministry and doing a great job. And my right-hand person, Minister Jones, Deputy Premier, Minister of Health, and everything else that goes underneath that. Thank you for always being there. And I want to thank everyone from the University Health Network, their whole team, I mentioned Dr. Smith, Dr. Forbes, and Dr. Okranik, and Pam Hubley, thank you, especially all the nurses, and the other great doctor, Dr. Qureshi, and everyone at the Toronto Western Hospital for hosting us today. And a big shout out to all the amazing frontline healthcare workers here today. And I'm just so grateful for the work that you do and the sacrifices you do every single day. And, you know, in healthcare, there's a lot of sacrifices on special occasions, no matter if it's a special occasion at home or family dinners and birthdays. You put the patients ahead of your families a lot of times, and that's the sacrifice that the people have to know out in Ontario, what they do, the nurses and the doctors. Toronto Western is one of the oldest and busiest hospitals in the entire province, and the work you do here every day is nothing short of heroic. And thank you for helping to keep our people of this province safe and healthy. Today, we're here to celebrate a new milestone for this hospital, and I got a big smile on my face because it is a milestone for its staff and the people they care for, and for all of Toronto, and really, it's really beyond Toronto too. A lot of patients, I'm sure, come through the doors here. Today, I'm pleased to announce that our government is investing nearly $800 million for the new patient and surgical tower at the Toronto Western Hospital, and it's absolutely stunning. I don't know if you have a picture. Yeah, beautiful. Yeah, this is so good. Fantastic. You know, Dr. Smith, I remember when he came in, he's saying, we need a tower, all the way back from day one. Hi, I'm Dr. Smith, nice to meet you, I need a new tower. So anyways, just a great person. This historic investment will add 82 patient beds, including new critical care beds and 20 state-of-the-art operating rooms. It will help shorten wait times and ensure that Toronto Western, that this amazing team of frontline workers can continue to deliver high-quality, convenient care for years to come. Right across the province, we're getting shovels in the ground. We're investing almost $50 billion. This has never happened in the entire country, not to mention the province. It's $50 billion for 50 new hospitals or expansions of hospitals. Here in Toronto, that includes $12 million for the Hillcrest Reactivation Center project and $42 million for phase 2 of the stem cell transplant expansion project at Princess Margaret Cancer Center, and I'm very passionate about fighting cancer. We're also expanding our frontline healthcare workforce. Since 2018, we've added more than 80,000 nurses that have registered here in Ontario. In fact, in 2023, there was another record broken with more than 17,500 nurses registering to work, and another 30,000 nursing students in our colleges and universities just ready to come in and support communities across the province. We've also added well over 10,000 new doctors since 2018, and with those doctors, we're building new medical universities and adding more seats there as well across the province. As we see the population grow, we're growing at the fastest speed over any jurisdiction in all of North America. Over 800,000 people showed up to our province last year alone, and I'm sure there's more coming. We've empowered pharmacists to treat and prescribe medication for 19 common ailments. Just last week, Minister Jones announced $110 million to connect 320,000 more people to primary care teams. And we're investing to expand community surgical and diagnostic centers to connect people to surgeries they need sooner. Another area was $330 million towards pediatric care as well, and we're poured, I think it's $21 billion since we've been in office into healthcare, and that's absolutely incredible. Because of our plan, because of these solutions, Ontario now has the shortest surgical wait times in all of Canada, and currently lead the country with 90% of people connected to a regular healthcare provider. And that's incredible, but we know that there's still a lot of progress we need to do. It's always continuous improvement, in my opinion, and we'll continue working hard with our great healthcare professionals, listening to them. I always say, folks, that I'm not a healthcare expert, and going through the pandemic, I really relied on leaders like you, Kevin, Dr. Zahn, the whole team, and you were incredible. I always said, you're the healthcare experts, you take care of health. I'm the economy guy, I take care of the economy, and everything works well, and we're so blessed to live in the greatest jurisdiction in the world, Ontario. When it comes to your health, we're going to continue to invest in projects just like this one. We're going to continue working with our health partners and bring on more doctors and nurses. We're going to bring more convenience care to people here in Toronto and right across the province. I want to thank you again to everyone at UHN and Toronto Western for inviting us to be part of this special announcement. And I'm very, very grateful for all your work, and may God bless the people of Ontario. Now I'm going to pass it over to my champion, the Minister of Health, Deputy Premier Sylvia Jones. Thank you.
Well, thank you, Premier, and good afternoon. It is indeed wonderful to be here to celebrate the groundbreaking of a new patient and surgical tower at Toronto Western Hospital. I feel like I have to do this. Thank you to Dr. Smith and the entire team for the amazing healthcare workers who are part of University Health Network, for everything you do to provide patients and families with exceptional care each and every day. Through our Your Health plan, our government is making record investments in healthcare and making bold, innovative, and creative changes to strengthen all aspects of our healthcare system. We're making it easier and more convenient for people to connect to care closer to home and improving the healthcare experience of all Ontarians. We're continuing to make significant investments to expand and modernize our hospitals and healthcare infrastructure, with over 50 approved hospital development projects that will create more than 3,000 new hospital beds in communities across Ontario. This includes our government's investment of nearly $800 million for this new state-of-the-art patient and surgical tower at Toronto Western Hospital. And I know there are many people in this room who have worked a long time to see today, and I want to thank you for your persistence and your engagement with your government. This tower will add 82 new patient beds and 20 new operating rooms. This investment is part of our plan to expand our province's surgical capacity and ensure our hospitals and healthcare workers have the tools and resources they need to continue to provide incredible patient care. Thank you again to the tremendous team at UHN, our government, for continuing to work hand in hand with you to meet the needs of our growing communities and ensure Ontarians here in Toronto and across Ontario are connected to convenient, high-quality care closer to home. I will now invite Pam Hughley, Vice President and Chief Nursing Executive at UHN, to say a few words. Pam?
Thank you. Thank you so much. It's really exciting to be here on this day. And it's really an honor to celebrate this project and speak a little bit about how the new tower will enhance the work environment for our very dedicated nursing staff and health professionals. As we know, nurses and our allied health team, our professionals are the backbone of our health system and everything that we do at UHN. As we navigate a global shortage of healthcare providers, we need specialized skills and the leadership of nurses and allied health professionals in this province more than ever. And we need them to envision an incredibly meaningful career right here in Ontario, right here at University Health Network, Canada's #1 hospital. As UHN, we know that a healthy and healing workspace can inspire hope and meaning. It will help our staff, patients, and their families feel better and recover. This new tower will not only improve patient flows and clinical workflows, it will unlock new opportunities for UHN nurses to thrive, to become global leaders in exceptional care, education, and research. The 7,000-foot respite lounge, a space for care teams to rest and recharge, complete with the latest technology for group learning, will reflect the level of appreciation that we have for our very dedicated staff. These improvements will support UHN nurses as they advance their skills with creativity and innovation, generate new knowledge through scholarship, and help us reimagine the future of healthcare. On behalf of UHN's nurses and health professionals, I want to thank you, Premier Ford. I want to thank the Government of Ontario for this investment. I'd now like to call on my good colleague, Dr. Thomas Forb, UHN Surgeon-in-Chief.
Well, good afternoon, and thank you very much, Pam. It's a pleasure to be here with you all today. I just want to echo the thanks of the previous speakers, Premier Ford, Minister Jones, and the Government of Ontario for your commitment and your trust with respect to this TW Tower at Toronto Western. I'd also like to acknowledge two people who have really done a lot of the heavy lifting. Number one is Dr. Alan O'Kranick, who is in the room. Alan is our surgical lead for projects and infrastructure and has really done a lot of the heavy lifting. So thank you, Alan. And the other individual is unfortunately not able to be here today, but Ms. Rebecca Ripa, who's the Executive Vice President for Clinical Support and Performance, and again has led this project and will continue to lead it as we go forward. So thank you, Rebecca. She's looking from afar. So Toronto Western Hospital has served this community for over 100 years, and it looks it at times. The buildings that house our operating rooms are nearly as long. They're safe, but as surgical technology advances, so do the limitations of the current infrastructure. Our patients and our providers require modern equipment and improved infrastructure. As been alluded to, the 20 new operating rooms, including 3 with en-suite medical equipment for complex neurosurgical and spine procedures, will usher in a new era for UHN surgery and allow us to power the power of technology, artificial intelligence, and robotics. The tower's design included insights from our surgeons, our nurses, our patients, Indigenous health professionals, and many more. And we didn't just concentrate on the patients and our healthcare providers, but also concentrated on their families and their loved ones. That's what's meant to be part of a team focused on putting patients and their families first. So, Mr. Premier, Minister Jones, on behalf of UHN's Sprott Department of Surgery, again, thank you, and thank you, the government, for being part of the team. And I'll now call on Dr. Smith to conclude today's remarks.
Well, thank you very much, Tom and Pam. Great words. I want to echo those comments and particularly thank you on behalf of our patients. One of the great privileges of working in healthcare, and particularly in an academic hospital, is the people we get to serve. We are fortunate, but sometimes sadly required to look after the sickest people in our country. And it is a privilege to be able to do that in a purpose-built, state-of-the-art facility, second to none in the world. Thank you to this investment. This is a fortuitous time as Dr. Zahn completes her term. And if you'll indulge me, I just want to take a little step back in history. When we first began talking about this tower, I think that Dr. Zahn might have been a staff neurologist here. And you know what, little did we know that one of your last public visits during your tenure as Deputy Minister, along with Minister Jones, is to begin such an important project. So, Catherine, thank you for a career of dedication to people, of good public policy and stewardship of resources, in concert, of course, with the Premier, Deputy Premier, and Minister. A real thank you to Catherine. You're here. And we'll be expecting you at the ribbon cutting, Catherine, as well. I, like Tom, want to acknowledge our FM Pro team, the real estate team that is going to do so much work and has already done so much work in the short term. Rebecca Repo has been mentioned, also Ian McDermott, our Chief Planning Officer and our Executive Director. They have been working so closely with Alan, also with Dr. Qureshi, similarly with Ms. Marnie Escaf, our Clinical Vice President, very key performers in making this all come together. We've talked a lot about the clinical side of this, but I also want to recognize UHN is privileged to be Canada's leading research hospital. And in addition to the amazing clinical care we'll have the opportunity to deliver and the clinical research that will occur, right here in these walls, we will be better understanding the most basic mechanisms of human illness, from the molecular level right through to the policy level. So while this is a great investment for our patients directly, it truly is an investment for our country and beyond. We also are very mindful, and I know when I bugged the Premier and the Minister more frequently than perhaps I should have about this tower, one of the things that he reminded me is we're making an investment not just for UHN, but for Ontario. And that the population we serve, particularly in areas like neurosurgery and orthopedics and cancer surgeries and general surgery, draws from across our province and in some cases across our country. So this truly is an investment for the province of Ontario right here at UHN, and again, we want to thank you for that. Last but certainly not least, I want to thank Pam for speaking to and about our nurses and our allied health staff. More than ever, we know the intractable problem of health human resources is nowhere more acute than in nursing and allied colleagues. And operating rooms really don't work without having great nurses, great technicians, great technologists, and great colleagues in addition to our surgeons and anesthesiologists. This will make us a destination of choice, not only for retention, but also for recruitment. I want to close by saying a special thank you and also acknowledgement of our foundations. We are very fortunate to have two world-class foundations supporting a world-class academic hospital, the UHN Foundation and the Princess Margaret Cancer Foundation. In this project, the UHN Foundation will raise in excess of $300 million to complement the remarkable investment by our government to again ensure the very best infrastructure, scholarship, clinical care, and quality of work life. So Julie, Raj, I want to thank you in advance for all the money that I'm going to spend, which you're going to raise. That, ladies and gentlemen, concludes a wonderful, wonderful day at UHN, a long time coming. Premier, Deputy Minister, a very happy day for all of us. We couldn't be more grateful. We look forward to welcoming you back to put the shovel in the ground and then to cut that ribbon as new patients get care here. And with that, the formal portion of the program has been concluded. Thank you all for joining us.